Welcome to Beyond the Diagnosis, everyone. Today, I want to start with a question that may feel a little uncomfortable. What happens when your patient's wearable device detects a serious health risk before you do? Imagine a patient walking into your clinic feeling mostly fine while their smartwatch has been tracking subtle cardiac irregularities for days. An algorithm flags a pattern suggesting early atrial fibrillation, and further evaluation confirms it. Are we witnessing the future of medicine, or is this already our reality? As physicians, we have to consider how predictive analytics, telemedicine, and continuous monitoring are reshaping care.
Absolutely, Jennifer. The shift is real and immediate. I mean, it's not some far-off sci-fi scenario anymore, is it? We're seeing it in practice. Artificial intelligence doesn't replace clinical reasoning. It expands our visibility into patient health in ways we never had before. But with that power, as you said, comes responsibility.
Exactly. Are we prepared to interpret these alerts, integrate them responsibly into our workflow, and maintain clinical judgment amid an influx of real-time patient data? I want to challenge you to think about your role in leading this transformation rather than reacting to it. That's the core of it for me.
And that's where understanding the how comes in. Physicians really must understand how these algorithms are trained, how they're validated, and crucially, where their limitations lie. Predictive models can undoubtedly improve early detection and chronic disease management. That's a huge upside. But they can also produce noise, right? Think alert fatigue, and then the ethical dilemmas around overmedicalization or even equity in access. Not everyone has a smartwatch, for example.
Alert fatigue is a major concern. I've heard countless stories from colleagues who are just drowning in notifications from various patient portals or monitoring systems. How do we, as a medical community, sift through that noise without missing the truly critical signals?
It's a huge challenge, Jennifer. It requires a thoughtful approach to integration into clinical workflows, clear governance for how these alerts are prioritized and acted upon, and frankly, continuous education. The clinicians who engage thoughtfully with these tools, asking hard questions, piloting responsibly, and protecting patient safety, they're the ones who will shape the future of healthcare rather than just being shaped by it.
That's a powerful point. It's about proactive leadership. Let's dig into that hypothetical atrial fibrillation patient for a moment. They come in, feeling fine, but their device has flagged something. How do you approach that conversation? Do you immediately trust the device, or do you start from scratch with your own diagnostics?
It's a delicate balance, isn't it? You can't ignore the data, especially if it's from a validated device, but you also can't let it override your clinical judgment. My approach would be to acknowledge the information, say, "That's interesting data you've brought in," and then proceed with a thorough history and physical. Maybe we order an ECG or a Holter monitor to confirm. The device acts as a trigger, an early warning system, but the diagnostic process still relies on our medical expertise. Use arm here.
So, it's about adding a layer of information, not replacing the fundamental diagnostic steps. It's almost like having an additional, always-on observer for your patient, which can be incredibly powerful for conditions that are intermittent or asymptomatic.
Precisely. Think about hypertension. Traditionally, we get a blood pressure reading in the clinic, maybe a few home readings if the patient is diligent, but with continuous monitoring, you get a much richer picture of their daily fluctuations, their response to medication in real time. That's invaluable for titration and personalized care.
Or even something like diabetes management. Real-time glucose monitoring has revolutionized how patients and doctors manage the disease, allowing for immediate adjustments and preventing dangerous highs and lows. It's a game changer for chronic conditions.
Absolutely. And that's where the expanded visibility really shines. We move from episodic snapshots of health to a continuous movie. For chronic disease management, this translates to better patient engagement, better adherence, and ultimately, better outcomes. Patients become more active participants in their own health journey when they can see their data.
But let's pivot back to the challenges, because they are significant. You mentioned alert fatigue. What about the legal implications? If a wearable device flags something and a physician misses it or dismisses it, what's the liability there? That's a new frontier we're navigating.
Oh, that's a huge one, Jennifer. The legal framework is still playing catch-up, which is always the case with rapid technological advancements. Currently, the onus is on the physician to properly interpret all available data, and that increasingly includes data from patient-generated health data. It means we need clear protocols in place for how we triage these alerts. Do we have a system for what constitutes a critical alert versus something for routine follow-up?
And that leads to the workflow challenge. Most clinics are already stretched thin. Integrating continuous streams of data, often from disparate devices, into an electronic health record system that might not be designed for it, it feels like we're trying to fit a square peg in a round hole sometimes.
Exactly. Integration is key. We need interoperability and, frankly, EHR systems that are smarter about ingesting and presenting this data in a meaningful, actionable way, not just a raw dump. Imagine a dashboard that highlights trends, flags significant deviations, and minimizes the need for manual data entry. That's the ideal, and we're not quite there yet.
It sounds like a massive re-education for physicians is needed too, not just about interpreting the data but understanding the underlying technology, knowing how an algorithm works, what its biases might be, what population it was trained on. That's a whole new skill set we weren't taught in medical school.
Absolutely, it's about digital literacy for physicians. We need to be critical consumers of AI and data. We need to ask, is this algorithm FDA approved for this specific use case? What's its sensitivity and specificity? Is it transparent? Is it explainable? If we don't understand these fundamentals, we're just blindly trusting a black box, and that's not good medicine.
And what about the ethical dimension of equity? These devices and services aren't universally accessible. Are we creating a two-tiered healthcare system where those who can afford continuous monitoring get superior proactive care while others are left behind?
That's a very serious concern. We absolutely cannot exacerbate existing health disparities. Solutions need to be thought about at a systemic level. How do we ensure that these technologies are not just for the privileged few? Could insurance companies cover these devices, or can healthcare systems provide them to vulnerable populations? These are questions we must grapple with as we integrate more deeply.
It ties into overmedicalization as well. If a device is constantly flagging minor anomalies that wouldn't traditionally warrant intervention, are we going to be doing more tests, more procedures, causing more anxiety for patients without a real clinical benefit? The cost-benefit analysis becomes crucial here.
Absolutely, we risk a worried well phenomenon on a much larger scale. It goes back to clinical judgment. Just because we can detect something doesn't always mean we should immediately intervene or even highlight it to the patient without proper context. We need to define thresholds and understand the natural history of some of these subtle findings.
So how do we as physicians lead this transformation? It sounds like we need to be at the table where these technologies are being developed, where the policies are being made, not just waiting for them to be handed down to us.
Precisely. It means getting involved, it means speaking up, it means educating ourselves. We need to collaborate with engineers, data scientists, and policymakers. Physicians have a unique perspective on patient safety, clinical utility, and workflow integration that no one else has. Our voice is critical in designing these systems to be truly beneficial, not just technologically impressive.
I think it also means embracing a new kind of patient education. Patients are coming in with data, sometimes with a lot of anxiety from that data. We need to be able to interpret it for them, contextualize it, and reassure them while still being thorough.
That's a huge part of it, building trust in this new landscape. Explaining the why behind our decisions, whether it's confirming a device alert or deciding to monitor something rather than intervene immediately. It's about empowering patients with information, but also providing that expert filter.
Let's talk about the future then. What excites you most about these advancements, despite all the challenges we've discussed?
What truly excites me is the potential for truly personalized preventive medicine. Imagine a future where we can detect diseases years before they become symptomatic, where we can tailor treatments with incredible precision based on real-time physiological responses. That could fundamentally change healthcare from reactive to truly proactive. That, to me, is incredibly compelling.
I completely agree. The ability to intervene earlier, to prevent suffering, to improve quality of life on a massive scale, that's the dream, right? And these technologies, if harnessed responsibly, bring us closer to that.
And it also frees up physicians to focus on the human element of care. If some of the data crunching and routine monitoring can be automated, we can spend more time on complex cases, on empathizing, on building rapport with our patients. AI isn't here to replace the doctor-patient relationship, it's here to augment it.
That's such an important distinction, Grace. It's not about becoming robotic, it's about leveraging tools so we can be more human in our interactions when it truly matters, more present, more empathetic.
Exactly. So, for our listeners, what has your experience with digital health taught you? How are you using these insights to improve patient outcomes? We genuinely want to hear your stories.
Share your experiences, leave a comment, or forward this discussion to a colleague. How we engage now shapes the future of medicine. Let's not be passive participants, let's lead. Thank you, Dr. Grace Cham, for such an insightful conversation today.
My pleasure, Jennifer. Let's keep this conversation going and spark the discussion. Join us in leading the evolution of modern medicine.